joining us here on this segment. Is one of the biggest thought leaders in the space. That I've ever met, and she speaks at our events and is well known throughout the industry. Jody Dietel is the Chief Compliance Officer with WageWorks, and she joins us here on IHC Radio. Welcome to Healthcare Consumerism Radio, Jody. How are you?
I'm very good, thanks. It's a pleasure to be with you guys.
Jody, for our audience who doesn't necessarily know the depth and breadth of WageWorks, kind of give us a brief overview of WageWorks, and then we'll dig into your topic here on private exchanges.
Sure, thanks. WageWorks is the leading provider of consumer-directed benefit accounts. We serve 45,000 employers nationwide with 4.5 million participant accounts in consumer-directed benefits. We also have an active role in the public exchanges, serving as the premium eligibility and billing vendor for some insurance carriers. And then in the private exchanges, we have several partnerships going, really because in the private exchange market, if you've seen one, you've seen one. There's several different varieties, but many of them are partnered with consumer-directed benefit accounts to encourage consumer engagement.
Now, Jody, a lot of your topic here is discussing strategies for effectively navigating and utilizing private exchange solutions. And what product strategies do you see in these different private exchange models that are emerging out in the marketplace?
Well, I think first it's important to remember that the private exchange concept isn't really new at all. I mean, there's been these, Amazon-type purchasing arrangements for a long time. I think the difference and the reason there's so many varieties right now is that the market is changing so rapidly as a result of the Affordable Care Act. I think they're only called exchanges because that was the initial terminology that healthcare, the Affordable Care Act used. They've now changed it to marketplace. Maybe we should call them private marketplaces as well. But the idea here is that whether individual private exchanges or group private exchanges, there's a variety of different options that basically provide greater purchasing power, give the employers the opportunity to provide, in most cases, a defined contribution arrangement, giving the employees opportunities for choice. Sounds to me like the original Flex Benefits program. I don't know, Ron, you probably would agree with that.
Yeah, in a lot of ways it does. It gives people, we're really in a stage people want choice, convenience, flexibility, options, all those sorts of things. And, yeah, we're kind of going back to the future in some ways with flex benefit designs and flex credits and those sorts of things.
Right.
But Jody, what is WageWorks working with multiple exchanges? How many exchanges are you working with? Do you just have your own exchange? Do you focus on a single one? Help our audience understand how you're interacting with exchanges.
Yeah, we don't have our own exchange. What we do is we partner with a variety of different exchanges and different models. So, as you know, they can be single carrier with multiple options with one carrier. They can be multiple carrier with multiple options. They can be insured arrangements or self-insured arrangements. And I think that's really the challenge for employers right now is that when you kind of put your toe in the private exchange waters, you have to really make sure that you're understanding the variety of different options that are out there, how they're constructed, how that impacts your own obligations under ERISA and Department of Labor and, all of those sorts of benefit regulations, because it's not as though you can simply wash your hands, give your employees some dollars, and then, kind of throw up your hands and not have anything to do. So you still need to make sure that the vendors that you're working with, the private exchanges that you're working with, you have clear understanding of what the employer's obligation is, who does what technology is available, and really what sets that exchange apart from others. We've found that a single vendor technology solution with all sorts of transparency tools, wellness tools, those sorts of exchanges tend to work better for employers, but really you have to kind of vet all of those different opportunities and see what the strategy is behind the exchange.
So are you're finding that one type of an exchange is more successful than another, or a certain technology platform or bells and whistles that one might have create more success? Tell us a little bit more about that.
I think that like the health insurance marketplace as a whole, I think that the private exchange market is going through rapid transformation, and what we saw, 2 years ago with the initial one, is fine-tuning and expanding and maturing every year. So I'm not sure that even what worked well last year, will be the same thing that happens this year. What I do know, though, is that the majority of consumer engagement and the best plans that we've seen are those plans that pair the employee choice with some sort of consumer-directed benefit account, whether that's a high-deductible health plan, an HSA, a high-deductible health plan or consumer-driven health plan, and an HRA, integrated HRA, or even the flexible spending arrangement. Wellness incentives are a key part of many of the very successful programs that seem to drive the most employee engagement, employee satisfaction, and then certainly making sure that the technology works and it's easy to use by the consumer.
One of the big areas of interest is by brokers. How do you see exchanges affecting brokers, pro or con? Is it helping, hurting them? A lot of brokers are very uncertain about their existing client relationships and their block of business. How do you see all that?
Well, I think it is a very, it's a very nerve-wracking time for all of us. I personally consider it the perfect storm in my career. I mean, why wouldn't I want to engage at this point? Because there's so many different market pressures and economic pressures converging at the same time. So I think the broker uncertainty may be because they don't know where to turn for really understanding what's going on with the different markets play, and I think that's why IHC has had such a positive impact on brokers, because there is sort of an independent source where they can go and find out about everything all at the same time. So it's a new game for brokers. They need to understand all the ins and outs of private exchanges, how they're structured, and it's not just that you can sell, an insured group arrangement with, one or two of your favorite carriers or anymore. I think the other thing that brokers need to be aware of is they need to get close to their clients. Sometimes I think the private exchange market and just kind of the market uncertainty creates an opportunity for employers to kind of learn on their own. And as I'm sure you'd agree, there's a proliferation of conferences and places where you can get information about what's happening in the marketplace. And really for the employer, the benefits professional or the benefits manager, they have a responsibility to their own CFO and management team to make sure that they're looking at all of the new strategies that are out there to see what's best for their employees and for their bottom line. And if a broker's not close enough and being the source of information to those employers or guiding or attending conferences with them, I think that could create the uncertainty about the relationship they have with their clients.
So how does a consumer, I want to go buy an individual insurance policy. How do I know what exchange is going to be good for me? Who leads me there? Or how do I go on some Google search to find good quality exchanges, or do I just go to my broker and have him direct me? I'm lost as a consumer. I'm confused about healthcare anyway. How do I find out the right exchange that's going to work for me and give me the right options that I need?
I would say as an individual consumer, that exercise is not for the faint of heart. I don't think there really is a very good single source. I think IHC has made great strides for that. However, as an individual, I might not know that you're out there. So I'd start as, with a Google search, which I think, many consumers would. But when you do a Google search about health insurance or private exchanges or finding the best health insurance for me kind of thing, you're going to come up with, thousands and thousands of search results. So I would start with a broker advisor. Even if I've never bought individual health coverage before, I might call, my car insurance broker to find out if they know somebody who's reputable and who can help. But it is an exercise for the faint of heart, as you know, and I know, being in this business for a long time. It is a very complicated decision tool process to go through to find your own health insurance.
Jody, with now transitioning over to the employer side of that, I think, with a lot of the employers out there, and you had alluded to it at the beginning of the segment, there's a lot of different models. And how does that employer, really understand what's the best model to provide to their employee population that they need to serve?
Well, I think, again, also for benefit managers, that exercise as well is not for the faint of heart. If you're a small employer, certainly relying on your broker advisor would be the first place to start. Certainly if you're listening to this radio broadcast, you'd start with going to IHC resources, because that's a good place to start. If you're a large employer, you probably already have some advisor relationships who have been talking to you about it. My caution and suggestion would be make sure that you also engage counsel, because many of the models bring with them different twists as to the employer obligations, and you want to make sure that you understand what obligations the exchange is taking for you, what obligations you still have, and then how are you going to get the information to do the appropriate reporting, particularly if you're an applicable large employer and have some ACA reporting requirements. That alone can, be enough to create gray hairs on a daily basis.
Jody, there's been a lot of news lately of some well-known employer organizations rolling out a private exchange, whether it be through a big brokerage house that owns a private exchange, or whether it be through some of the other companies out there that own a private exchange platform. What examples have you seen out there of companies adopting private exchanges and their use of the consumer-driven benefits, as you put it?
I think for many employers, there's probably every day a new announcement about a certain new employer taking that. What I'm seeing is it very very popular in those populations that have a lot of variable hour employees. So, the retailers and the hotel, hospitality chains, restaurant chains, those are seeming to be very prime candidates for a private exchange, because I think it allows them to provide many more options for their employees and to address the defined contribution arrangement. So that's kind of been my anecdotal impression. What I have seen, though, is that employees, when given the right tools and the right opportunities, they're picking consumer-driven healthcare plans. They want to, be wiser consumers. It might be a big change. There's lots of educational responsibility on the part of an employer in exchange when you go there to educate employees. But I think when you give participants the right tools, they want to get in the game and they want to use these healthcare dollars in a wise and effective manner. And additionally, there's a lot of wellness components. So what we're starting to see is trends on the employer side where their workforce is actually taking control of their own health status and improving on it.
Jody, you're working both public and private exchanges, is that correct?
Yes, we do.
What do you see as the differences there? What are the different dynamics, the populations? Can you draw some comparison between the public and the private exchanges?
Well, I think the challenge for the public exchange, is not any news. I mean, there's been technology challenges. I mean, the transformation for that, arrangement that's handling, 34 or 37 states in the case of healthcare.gov, the kind of efficiencies, the kind of system loads, all of those things can tend to frustrate out of the gate the consumer. I think the second thing is that just managing the options that are available on the public exchange is such a big task that we don't see a lot of ancillary benefits. So one of my, biggest frustrations and really one thing we've communicated to the administration is that, we can help you identify consumer-driven health care. So, for example, there's a great percentage of plans on the public exchange that is HSA qualified, but there's nothing, clear to the consumer that they are now eligible for a tax-favored method of creating their own safety net into the future for maybe these larger out-of-pocket costs. I think there needs to be also some greater communication on the public exchanges, just because consumers have been, if you, again, anecdotally based on news articles, I think consumers have been a little surprised at both, maybe their plan choice had a much narrower network than they understood, or greater out-of-pocket expenses than they understood. So I think there's an opportunity on the public exchange to kind of drill down and improve the participant experience. I think that's a huge task. Kudos, it's gotten a lot better. But both healthcare.gov and the state exchanges, as well as private exchanges, will go through continued maturation processes, I think, over the next few years.
Jody, we've really appreciated you joining us here on Healthcare Consumerism Radio this morning. Leave our audience with a couple key takeaways, if you could, please.
Well, I think the most important thing is to join us in Dallas soon for the Private Exchange Forum. I think it'll be kind of a jam-packed, get your knowledge up to speed. The sessions are just incredible and will be a lot of fun and a great opportunity to understand the differences in models and exchanges, and to really do some networking with some very, very incredibly gifted and expert people. I think second of all, test the waters. You ought to become informed about private exchanges, about this defined contribution approach, and the different structures that the exchanges have. And third, make sure that you use the resources available from IHC.
Well, Jody, thank you very much for joining us today. And to our audience, Jody will be actually moderating a general session for us out there in Dallas with leading health plans, and talking about what the health plans are doing in the private exchange marketplace. So make sure you come to see that. And Jody, again, really appreciate you joining us on the program. You have a great weekend.
I will. You too, guys. Thanks.